and we're good. Go ahead.
Okay, well, we'll give people just a few more minutes to come in. I see the participant panel starting to fill up with names, so we'll just hold on for a minute or two, and then we'll officially kick things off. Things off, and I'm sure we'll have others join us as we move into the time for our session today. So I'd first of all like to welcome everyone and thank you for joining us for this installment of the Ask the Expert Q&A session on COVID-19. My name is Jeff Beach and I'm with Cystic Fibrosis Canada, joined today by my colleagues, as you can see, Ian McIntosh and Devin Sherman. And it's our pleasure to host you for this, which is the latest in a series of Ask the Expert sessions that I know many, if not all of you who are joining us today are aware of, and some of you may have joined us live or viewed the recordings of the previous sessions. Both of our experts who are with us today were part of earlier sessions, but have joined us today to really, I think, sort of check in again on things and talk more specifically about the theme today, which is reintegration, and by that we mean returning to somewhat normal life in terms of work, school, and everyday aspects of life. So we'll get into some questions and get the thoughts and advice on these matters from our experts in a few minutes. In the meantime, just to reiterate, as I said, this is part of a series of Ask the Expert sessions that we've been pleased to host over the last couple of months, both in English and in French. This session will be in English only, but there are recordings available of both the previous English and French sessions. There are 3 sessions that were held in English and 2 in French, all held in the month of April and into early May. And they are available, and I must say they've been quite readily watched, viewed. We had quite a number of views on those earlier sessions. So it does seem like the community has found them and found value. And again, we thank you all for joining and helping us to promote this to others as well, because it's important that we get this information out as widely as possible to everyone in the CF community. Just in terms of a bit of etiquette on the Zoom session that we're using today, participants are, except for the panelists, are muted, with the exception of myself and Ian. That is to, of course, avoid any background noise and distractions that often occur during large video calls and conference calls of this nature. But we'd like to take this opportunity to thank everyone who submitted questions in advance of today's session. We did have quite a few questions that came in through social media, through email, and so forth. We will do our very best to address all the questions, or at least cover the themes of the questions that were submitted in advance. And we also invite you, if you do have questions that you didn't get a chance to submit, or as we're going through the session today, if it triggers other questions, please feel free to submit them through the chat feature here in Zoom. And Ian will be monitoring those and relaying some of those questions to me as well. So if you have questions, please feel free to ask them via that method. And of course, this is not an end-all be-all. We will have future opportunities, and we do have a service that is available to you. I'm sure most of it, again, if not all of you are aware of it, but just to reiterate that we do have an information and referral service available as part of what we offer as Cystic Fibrosis Canada for the CF community, that is available any day, anytime, by emailing advocacy@cysticfibrosis.ca or calling our office, 1-800-378-2233. And if you need that information, of course, it's on our website. And you can reach someone there anytime who will help you find the information you're looking for or the resources you're trying to avail yourself of. And as I have said in other sessions, if we don't have the answers immediately, we will work to find those for you and work with you to find the information and resources that you're looking for. Finally, I just want to mention that the website itself, cysticfibrosis.ca, has a wealth of information that we are continuously adding to. I'll just mention specifically today around the COVID-19 section. We started building that section of our website immediately once it became apparent that this pandemic was unfolding a few months ago, and we've been adding resources to it as time has gone on. So that lives on as a resource that's available to you. I will point out that one of the things that we've added since the last time that we had a session like this is a section that details all the provinces and their reintegration plans. So we'll be talking about some of those things today. Of course, we won't be getting into a lot of specific details province by province, but as is typical in Canada, every province is different. And of course, some provinces have lifted restrictions in some areas, whereas others are slower or doing things a little bit differently in that regard, taking a different approach. So I would encourage you to visit cysticfibrosis.ca, find the COVID-19 section, which is one of the main sections that you'll see when you initially land on our landing page. And within that, you can find those details for the province that you live in. So having said all that, it is my pleasure to introduce our experts for today's session that have joined us. As I've said in previous sessions as well, we have an outstanding team of clinicians working in CF clinics right across the country, and we're so grateful that we have two of them joining us today and sharing some of their time and expertise to answer questions from our community. So I will ask them to introduce themselves in a moment with a little more detail, but please join me in welcoming Dr. Mark Chilvers from the Pediatric CF Clinic at BC Children's Hospital in Vancouver, and Annie Thomas-Diceman, who's a clinical social worker with St. Michael's Hospital in Toronto. Mark, do you want to kick things off?
Thanks, Jeff, and thanks. That was a nice introduction. Yeah, I'm Mark Chilvers. I'm the CF Clinic Director at BC Children's Hospital, and I've been here for the last 12 years. And it's a really interesting time the last few months. What we thought was normal has changed, and we're now moving into a new normal, and that's going to have an impact for families, for patients, and for the CF team members as we adjust to this new way of working and caring for individuals with cystic fibrosis. So I'm really pleased to be part of this RCS expert today. Thank you.
Thanks, Mark. Annie?
Hi, everyone. I'm Annie, and yes, thanks very much for the introduction, and thank you very much for this opportunity to speak. And as people may have seen on a previous talk, I have been in this clinic for the last 20-ish years, and I work at St. Michael's Hospital with the adult clinic and the adult team. And it's interesting, when I got asked to do this talk, these kind of conversations are very much happening at our clinic with our patients, with our families that are contacting us. So this really came at quite an ideal time to do this in a little bit of a grander scale because these questions are coming every day. So thank you for this opportunity.
You're very welcome, and thank you both. So I'll just remind everyone as well that these sessions are not intended to provide specific medical advice. Of course, we would ask that you consult with your clinic team, with your CF clinic physician and the rest of your clinical team with questions regarding anything around your own personal healthcare circumstances. As I said earlier, we did receive a number of questions, and we'll try to address as many of those in whatever specifics we can today. So just looking back, I guess it was about 2 months ago that we launched the initial series, I guess, on COVID-19 and CF. And so in some ways, things have changed a lot since then. In other ways, things have not and remain the same. But maybe we can just sort of start off with a bit of a snapshot from both of you in terms of the pandemic situation today and clinical care. So what I mean by that is, how are your clinics continuing to manage things under COVID-19, and what are some of the ways that you're managing care that is different? As Mark, you alluded to the fact that we're living in a different time, and we expect that some of these, the way that we're doing things will continue to evolve, and some of these changes will last and have a lasting impact. So maybe you can just start by commenting on how things are going right now with you in your practice in your clinic?
Okay, thanks, Jeff. Obviously we've everyone is social distancing and isolating at home, and so every clinic across Canada has worked to minimize exposure of patients to any potential COVID-19 infection. And so most clinics are now going to a virtual system. So initially it was telephone calls, but now people are using these platforms such as Zoom or Skype for Business to do clinic visits in the home. And one of the benefits of this is the whole team can get onto the call, and so therefore it actually is a lot more efficient way of doing the clinic. And so for patient satisfaction, I think that's been a very positive thing that we've had feedback from, particularly in BC. The other thing which we've been working on is to do sputum samples and cough swabs from home. So we've now got kits that we send out to families, which they can then do the samples, drop them off in their local life labs, and then that gets sent down to the hospital and gets processed. And again, that minimizes exposure, and it allows us to do our routine surveillance, because we still want to see patients every 2 to 3 months. And I think the other thing as well is you can only do so much by virtual health. We rely a lot on spirometry to guide decision making, and so that's something that we're now thinking of, how do we do that? And I know some clinics are purchasing spirometers which can be sent out and they can do spirometry at home. But as with everything, it doesn't take away the physical interaction and the physical examination. And so we're working now towards trying to see patients every 6 months in person as we start to open up, so we can actually do that physical examination and see how they're doing. So that's where things are in BC. I don't know from St. Mike's, Sally, with the adult population.
So I would say there's a lot of similarities that we're following here at St. Mike's. I think I don't work in clinic predominantly. I'm much more focused on the inpatient side. However, what I do understand is very much we have shifted to a virtual clinic. It's primarily been our physicians and our nurses that are in the clinics doing either phone calls or a OTN. We have the Ontario Telemedicine Network is what we use as our virtual platform in Ontario. And we have slowly been moving into Zoom as the hospitals accredited that for healthcare practices. But I think people are still primarily using the OTN. We haven't actually done a group virtual meeting with patients, but I feel I've heard that a lot in a lot of the clinics across the country, and I feel that patients may really like that. I think it's for us is just trying to figure out how to coordinate it. We have up to potentially 40 patients that are booked in our clinics on a daily, on a Tuesday clinic. So it's just a matter of making it work, but I'm definitely hearing great feedback about that. I think your comment around the pulmonary function lab is really a big piece of any kind of CF care, and this is something that's been on our radar for a while, and I think our medical team is working with our pulmonary function lab and infection control within the hospital trying to figure out how to do this in the safest way possible. So as it is now, we do have on every clinic visit or every clinic week, we have probably 2 or 3 patients that are physically coming into our clinics, and this is obviously something that the physicians have determined that they need a face-to-face visit, and those people do need to go through whatever that risk may be to get that pulmonary function test, but we are trying to avoid the routine pulmonary function testing and the routine visits if it's unnecessary. So really, I think we're starting to shift from this model of just getting by to this new system of what are we going to do, because this is new and it's not going anywhere, and we have to get back to care like it has been in the past, at least following up with people more frequently so that we can see and we can catch things as they come along. So it's really interesting to see that the talk is there and the conversation has really started, but as we see changes in the prevalence of COVID, we're going to have to then see what we can actually do. But the conversations are the same.
Thank you. So one of the things that's quite different now, I would say, as opposed to the last time that we had both of you as part of our sessions that were hosted in April, is at that time, pretty much everything was shut down outside of grocery stores and whatever was deemed provincially to be essential service. Now we're starting to see things reopen to certain extents. And of course, as I mentioned earlier, that can vary greatly from province to province. So a lot of the questions that have come in from the community have been around concerns about stores reopening and more gatherings happening and so forth. In general, I would say one of the themes of questions that have come in is for people who have CF or for families who have a child with CF, and knowing that these things are happening and more stores are reopening and so forth, how should the families and individuals living with cystic fibrosis approach this? Do you recommend that they continue to reintegrate much like other members of society are in terms of social distancing, or is it best to just continue to avoid going into stores where possible, or setting yourself up in terms of those sort of social gathering situations?
Okay, that's a good question. And there's one word which springs to mind, Jeff, is carefully. I think that's an overriding thing because, yeah, we're learning about COVID-19. We know that it's for many patients with cystic fibrosis, if they were to get infected, that it tends to be more of a milder illness. And there's now data being published from many international centers looking at the impact of COVID-19 on CF patients. And there was a nice resource that Annie sent through from the European CF Foundation, which looked at the number of patients with cystic fibrosis who were infected with COVID-19 and their outcomes on there. And I think the outcomes have been very reassuring, which is good in terms of sickness and in terms of patients passing away from COVID-19. I think there was only one reported death from a patient with cystic fibrosis. So when you think about the population of CF patients in Europe and in North America, that to me is reassuring that COVID-19 infection is likely to be mild depending on your clinical state. That being said, what we're recommending here is we're following what our provincial medical officer is stating in terms of moving from phase 1 to phase 2 and into reintegration into society. I tend to be very cautious. I think where there's situations where you can't adequately social distance, such as in supermarkets and Winners or whatever, it's important not for those patients to go into those situations. For our families, we would advise one of the parents to go to the shop and not bring their children into those situations. So I think it's cautious and careful is my way forward. I think it's important still to do the social distancing with personally with people you don't know. And I like the phrase is double your bubble. I think that's a really good way of approaching this in terms of you've got your inner circle and then gradually you're going to double that bubble and then see how things go with that. I think the other thing as well is just being careful in terms of if somebody's sick, making sure that they don't come in contact with you or with your family. So that's sort of how I've been approaching this.
And the only thing I'll add, because we're saying the exact same thing here, Mark, and to our patients at our clinic, is that we're, because our patient population are adults and we're dealing with them being the ones doing the grocery shopping and them returning to the workforce, a lot of what we're providing is carefully, and we don't know enough yet as this phase is starting. And if you can step back and if you can wait, this is the safest thing for you to do until we know what may happen in that first phase of reintegration. And I think as a social worker, and I'm certain other social workers across the country are having the same types of conversations, is that our patients are looking for more reassurances around the decisions that they're making and the choices that they're being offered. And as much as we would like to give guarantees of what would happen next, we can't. And we have to be able to provide this information, but then patients and families need to take this information and figure out, well, what can they do? What must they do? Is there no one else to go grocery shopping? And then following the guidelines set out by, the government, so that they can be as safe as possible, but knowing that we don't know for sure.
Thanks. And if I could just add on to that as well, I think because the other thing is that CF patients and CF families have been doing the social distancing and the hand washing for years. This is nothing new to them, and it's kept them safe prior to COVID, and it's going to keep them safe post COVID.
Yeah, it's a great point. It's nothing new in that respect, although things are obviously heightened, especially in terms of physical distancing protocols. But overall, I would say this is a community that was well prepared, if you will, for this type of situation. And we're certainly seeing that in the data that you've referenced too, that it hasn't, that there's been some encouraging data that's been shared. And so thank you for sharing your advice on that. In terms of, Mark, you mentioned sort of double the bubble and expanding the family circle, I guess, is another way that I've put it. There were quite a number of people from the community that submitted questions around that whole concept and how they can best manage it. So, you know, one example was from a CF mom who wrote that her parents had been isolating completely at home since March. So they had allowed them to see their son who has CF, who's a baby. He's 18 months old. And the husband, she and her husband have also been in complete isolation since then. Their parents apparently had relatives visit recently, and they were from about 8 hours away, so they stayed overnight. And obviously, the social distancing was not feasible, I guess, with having guests overnight like that. So then they're wondering, do they have to wait 2 weeks or not? Do you have any sort of advice in terms of those type of situations where, you can be very careful about your bubble, but then as that bubble extends, it's what's happening with the people that you allow in your bubble, what's happening with them, and it just sort of multiplies from there. How do you recommend that people approach this type of situation?
That's really challenging. I think what happens if your bubble bursts is the question. And I believe in people in making sound judgments. I think if people in that scenario, I would have hoped that if the people who were visiting, if they were at all unwell or sick, they would have cancelled the trip and wouldn't have done that. And it's really, really hard, because I see that scenario and I see, yeah, that's great. The grandparents have been isolating, the family's been isolating, and it's great that bubble can come together. And yes, when you talk about the social distancing, people talk about that when there's contact tracing. I was reading about this in terms of if you have more than 15 minutes within 1 meter of somebody, you're at risk of passing on the virus. This came through from the BBC website. And so therefore, when you look in that scenario, there is a risk of having a transmission of virus. But then again, those people were well and were asymptomatic. So it's, if you're going to be purist and you wanted to say, fine, 2 weeks, that's the safest way to be absolutely sure. However, that has implications. And I think sometimes you've got to be more of a common sense approach on this. Annie, I don't know if you've got any comments on that.
Not much more. It's pretty well the same. I think that's the big piece of being a purist and following the rules to the letter, and then also living the life and knowing that you've made good decisions and knowing that the people around you are being as safe as possible. I think we have to be a bit careful of having sort of big brother watching over us, always trying to make sure that we're doing the right thing. When we understand, or some of us will look at these guidelines and really do follow them. So there is some level of you taking this information and making the best decision that you can, given all of the options and weighing it all out. Because if it's at the risk of a mental health decline because of the lack of contact with a family member, then is it worth it? Is the risk worth it?
I agree entirely, and it is. We're at this moment in time as we go into phase 2. It's balancing the risks versus benefits, and sometimes it's really nice just to see somebody face to face, because that non-verbal interaction is just amazing.
Yeah, absolutely. So lots of questions, not surprisingly, around work and returning to work. When we had our earlier sessions, most people were working from home. Many still are. But in some cases, people have had no choice but to return to work. And some have been able to avail themselves of certain types of leaves and so forth and so on. But those options in some cases are running thin, I guess you could say. So as parents of children with CF, there were some questions that came in from parents around how they should approach this, again, in terms of being able to respect their need to go to work and to continue their employment, as well as balancing the risk that they may be bringing home in doing so. So I think in the earlier sessions we talked about there were certain parents that were separating themselves from the family when they were working and the other parent was not. Sometimes they've been able to continue that sort of arrangement, sometimes not. But I guess I'm not trying to answer the question here, but I guess it's sort of, looking at this balanced approach again. But when it comes to employment, do you have any advice, or perhaps even Annie, if we could start with you, if you've had these sorts of questions coming in through your practice at St. Michael's, and any advice that you've given people in terms of dealing with their union or HR departments or anything like that to try to balance that need to work and the risk of having a child with CF.
I think in addition to that, it's also having a family member in your home that has CF. It's not necessarily a child. So some of our patients in those types of situations. So I'm really trying to pass a message on to the people that I work with that most people are pretty understanding in this situation. So starting a dialogue with your employer around what the situation may be. And I have found in general, of course, there's outliers, but in general, people are willing to have that conversation, willing to accommodate these continued work from home scenarios, these staggered shifts, if those can be managed, so that the work gets done just in a different kind of way, but that the conversation starts. We also talked a little bit more around speaking to HR. What can HR provide for you to create a safe environment if you must return to work? And if it isn't in an environment that creates enough safety, that then you can refuse work. And so looking at union guidelines, looking at the Canadian Centre for Occupational Health and Safety, and following these guidelines and saying, you're not providing this for me, or if I've had a lot of patients send me emails or calls saying, this is what my employer is going to provide for me. Is this safe enough? And so we'll look at it and say, it seems reasonable, but there is still risk going back into that environment. And that's the point where you then have to look at it and figure out what's the best thing for you. So looking at your scenario, again, speaking with your clinic, speaking very closely with your physicians, your social worker who can help navigate some of this short-terms and long-term disabilities if you need to access it for a continued basis, or looking for EIs or continued serve if you need to. But the idea is having conversations about it. And again, in general, I find that most people have been quite receptive.
Thank you. Related to that as well is the question around a necessity for some people, and that's public transit, which seems to be obviously a concern where, again, you're expanding that circle, even if you have a fairly tight circle of coworkers that you're with, and you can work in an area where there are staggered shifts and physical distancing is being respected and so on. Public transit kind of throws that out the window. But for some people, especially those living in urban centers, that becomes a necessity in terms of them being able to go to and from work. So do you have any thoughts around public transit or even alternatives to it that people should consider?
That's a really good question. I don't have any clear-cut answers on that, because it is true. This is unfortunately a piece that has to be managed in order for people to get to the next stage of whatever it may be. So I feel that is a restriction. And that could be something that needs to then come to the table, that the medical team can help support the patients in saying that this person can't get to your work. The risk is too great because of A, B, and C, particularly around transit. And because of that, we continue to advise that this person remain at home, or again, for Mark, you may say your parents need to stay at home because that risk is too great to that child. So I think that is definitely part of that conversation. To impact on their ability to go back to work.
And I think just adding to that, Annie, is everybody, public transit workplaces have got a duty to ensure that their customers or their employees are safe, and they've got to follow provincial guidelines in terms of ensuring that it is a safe workspace or that there's safety on the public transport. And I think that if you do need to use transit, obviously they have things in place, which is minimizing the number of people on the bus, for example. And I think there are situations where I would want to wear a face mask, and then even just having hand sanitizer in my backpack so that I can sanitize my hands when I'm coming on or coming off that, if you are forced to do that. So I think that's one thing to try and mitigate the risk. And again, it's this risk-benefit balance. I think the other aspect as well is also, what is your clinical status? Because if you've got lung function, which is in the 90%, you don't get many pulmonary exacerbations, then the risk of contracting COVID is going to be low. So therefore, that's to your advantage. But somebody who's got low lung function and FEV1s around 40%, or those which have had lung transplantation who are immunocompromised, the risk of COVID in those situations is much, much higher. And so therefore, that's just my personal opinion. I haven't got there's not a lot of data to support that, but looking at this through a clinical perspective, for those patients where they have their health isn't optimal, they're at higher risk from COVID, and therefore I'd be advocating, and their clinics can advocate for them to support them from working from home or alternative transportation.
Great, thank you both. One of the issues that's become more prevalent, I would say, in recent weeks is around testing and the availability of testing for COVID-19. So do you have any thoughts around the need for testing if people are asymptomatic? And also whether testing may actually, an interesting question that just came in during the session today about whether testing itself may have some implications around social distancing. So is somebody actually putting themselves at risk by trying to be proactive in terms of seeking testing?
That's a good question. In terms of testing, I think there are guidelines as to who, and this is, I'm speaking from the BC perspective, as who should be tested, and there's a certain criteria, and if you meet those criteria, then you're referred on to a COVID testing site. The problem with the testing is we don't know how accurate it is, and there's reports that in 30% of patients they may test negative and actually be infected with COVID. We also know from the pediatric population that a lot of children may be asymptomatic who have COVID. And so that puts a question about the accuracy of the testing. So that's something which I would follow your provincial guidelines as to who should be tested. But it's interesting when I'm speaking to my families, there are families who feel that their child may have had COVID, yet they had a test which was negative or they didn't get tested. And this is where the next level of testing, the antibody testing to COVID, is going to come through. And that's something which is being rolled out across Canada, and certainly through CF Canada, there's a potential study going forward to test CF patients to see if they've had for COVID antibodies, to see if they've been infected or not. So that was the part on testing. Sorry, I missed the second half of the question, Jeff.
The second half was really is going ahead and seeking testing. Is that potentially opening risk unnecessarily? Yeah. Someone who doesn't need to, basically.
Yeah, and I think depends on the provinces. Some of them have drive-through testing where you're literally in your car and you drive up. There's details are taken by somebody who's in full PPE, and then the swab's taken from your nose, and then you drive off. And there, so I think from the COVID testing sites, I think there's strict infection control policies in place for that. So I think the risk of contracting COVID from a testing site is very, very low.
Thank you. Another question that's come in today was around people who are transplant recipients and immunosuppression, and whether, I know we touched on this a little bit in one of our earlier sessions and some of the Q&A materials that we've seen through our website and through the transplant centers as well, but perhaps you could just touch a bit on what might be different if we're talking about someone who is a transplant recipient versus someone who's not?
So I think from my perspective, just talking about work and children, my guess is that, well, not my guess, my feeling and what we're doing here is our threshold is much lower when it comes to supporting individuals and their risk. Because of the fact that there is a much higher risk to them, we will make suggestions, we will make recommendations much faster. Again, some of our clients are working in healthcare situations. And so we are absolutely telling them they cannot return to work and being quite absolute about some of those statements. And some of those people are post-transplant recipients. So it's really about their presentation, like Mark has mentioned before, their risk to developing COVID if they're exposed, and then the likelihood or the potential of them having a worse outcome.
I agree. I think this is on a case-by-case basis, and this is where the individual needs to contact their CF clinic to discuss this. And as I say, with St. Mike's, they've got a large adult population of whom many have had transplants, and I think that's the way to move forward. And I think in those situations, there is more risk with those patients. We don't know what that risk looks like at this moment because we're still learning, but I think it's something which they need to speak to their local clinic.
Absolutely. So shifting gears a little bit, I live in Ontario. I received a message a few days ago from my chiropractor announcing that they're reopening and booking appointments. And of course, other regulated health services are doing so in terms of dentistry and massage therapy, that sort of thing as well. The questions have been coming in as well around those types of interactions, because obviously when you're talking about chiropractic care or massage therapy or dentistry, those things are not possible with physical distancing. There's a lot of hands-on work and very close personal contact. So do you have any thoughts around how a patient or a family could approach this if they need to? For example, if a child or an adult, for that matter, living with CF needs to have some dentistry work done, what are some of the things they should be insisting on or looking for to make sure it's as safe as possible?
Good question. My one-word answer is wait. to be honest, for the keen attendees, I've not yet been to the hairdresser, and it's been several months with that, because I'm watching and waiting. That's my personal preference. I think unless it's an urgent thing, I think we can see how phase 2 opens up and see how that evolves. These businesses need to be following the guidance set out by the provinces in terms of being work safe for both the practitioners within the dental clinic and also for their customers. And I would be expecting that there certainly masks and face visors will be used by the practitioners, particularly in a dental situation. Plus, there should be screening of the clients coming through the doors as well, because if they're sick, they should be nowhere near that. So I think that's what's going through with in those high risk close contact areas. But my personal opinion is to wait as we open up. Unless it's urgent, I would wait. And the what I've been hearing is that up to 4 weeks. I think if we can wait 4 weeks, and if things are going well, then start booking those appointments. What are your thoughts, Annie?
Well, I would say I would echo the exact same thing. I was reading some articles in the last week about the exact same thing, and ultimately those practices, like some of them again require a lot more with regards to the PPE, but if you're going to the hairdresser, maybe not so much around them providing the PPE, but going to any dental or chiropractic treatment site, there are clearly guidelines that they need to follow. And like you said, Mark, it's only if the risk of not getting this treatment is great, and the advisement is to wait.
And I think certainly some hairdressers for example, are advocating for the client to wear a mask when they're going through
Yes.
with that. But it's yeah, it's if you think about these these areas in terms of hairdressing and things like that, they're not used to doing infection control. They have a certain level of infection control for the utensils, the scissors and combs and things like that. But they're getting used to putting this into place, and so there's going to be a learning process for these businesses. And that goes for restaurants and bars as well. Is what is their cleaning down a process? I was walking past one bar, for example, and they were cleaning down the table, but they didn't clean down the seats where clients or customers had been sitting, and they're a high touch area, and so people are still learning as they put in this as we move forward with phase 2. So I think, as I say, wait.
Yeah, I think it's a good way to wrap up that section in terms of anything that isn't necessary. Waiting is the best approach to take, and it requires patience sometimes, or in my case, allowing my wife to come near me with a razor to cut my hair, and it turned out okay. I think nothing a little gel won't hide to slick back, but
you're looking very good, very sharp.
I'm not fishing for compliments, honestly. But no, it's just going to require some patience and waiting. And I think we're all at that point now, whether you're somebody living with CF or not. We're at the point where everybody's itching to go out to dinner, go to the hairdresser, do the things that we all before this really took for granted as being able to do. But it's going to require some patience and monitoring the situation. And where possible, that's always the best approach.
I view it as an investment. Families and patients have invested this time so much over the last few months in protecting themselves. For the sake of a few weeks, it's not worth it.
Yeah, exactly. Some questions have come in, and they're reflective of some questions that were in earlier sessions as well. But as we look at outdoor activities, for example, if restrictions are lifted on team sports, for example, or even someone who is riding, doing some cycling on a trail where there are other cyclists, what would be your thoughts on risk associated with those type of activities that are strictly outdoors?
For me, I think the outdoor activity is fine. If you're cycling on a trail or a track, I think that's safe. With that, the interesting point about team sports, I'm not sure whether, because I see people starting to do five-a-side soccer and things like that. Again, it's risk benefit. It's great to get the exercise. We know that CF patients would really need to have that exercise as a way of their daily therapy. But in terms of team sports, I would be slightly concerned, because you don't know what those other team members, if they're well or if they're carrying the virus. So I'd shy away from team sports. But that's my personal opinion.
No, we would echo that. We're advising the same, that the benefit of you being out and participating in some type of activity is greater than you staying at home and not exercising. We're not fully recommending the team sports, but again, people are taking their risk, benefit, mental health, all this into consideration to decide what's best for them. But the idea that if you're on your own on a bicycle or walking past someone, is that it's very limited contact next to somebody, and so the risk is low from that point of view.
Thank you. So one of the, I would say, inevitable questions is around returning to school. And so this, of course, has been approached differently from certain provinces. We know that Quebec has been more aggressive in terms of reopening schools and returning to schools. Other provinces have not. This is going to be a question that will continue to be posed over the next few months. But whether we look at the situation now, or even as we start to look towards the future and towards the fall, there are a lot of questions and concerns from people with CF, both in terms of children who have CF, people who work within the school systems who have cystic fibrosis themselves. What are your thoughts around returning to school, and from what you've seen around the protocols that have been put in place for those provinces that have published them? What's your what are your thoughts, or what's your comfort level around this whole subject of returning to school?
That's a great question. And again, we're basing on our advice on common sense. There's no evidence to support that. And it's interesting. What we actually did is some of the clinic directors from the pediatric clinics actually did a Zoom call just to discuss this in terms of what we're advising our families. And I think firstly, we were following what the provincial medical officer was saying in terms of the schooling. But certainly in Quebec, I know that the clinics there have been doing letters to, if their child is falls into one of the more severe illness, or low lung function, or got CF-related morbidities, advising not to go back to school. And it's interesting, I've been watching Quebec carefully, and there is a spike in COVID cases from school children and in teachers. The question is, will that flatten out? But it's really challenging to do social distancing when you've got a kindergarten or grade 1 class. They're running around and they won't have seen each other. It's really challenging to enforce social distancing. And my feeling is, if there's online, certainly for the secondary schools, for grades 8 and above, if they can do online learning, I would recommend doing that. And certainly schools are doing 1 day a week in and staggering their classes. But again, I've advised my families to wait 2 to 3 weeks, see how the reopening of schools goes. And if we're finding there's more cases, well, then you've protected your child by not sending them to school. But if it seems to be fine and they're wanting to go to school, then that will be okay. But when I look at it, the school year is nearly over. And I think is there going to be any value gained by attending school? And I appreciate this also for supporting parents so that they can return to work as well, having the school.
So just in addition to what you've said, I agree with everything you've said, Mark. I think our parents are the ones that have CF. Sending their kids to school, again, it's now increasing risk to them as they come to and from the school environment. More of them, some of them obviously have children who have CF, but in general, it's the adults. I think what we're saying is, again, be smart, be safe. And it's this idea, I think, that conversations that I'm having with the patients that I've had conversations about school with is around, am I putting my children at a disadvantage of not sending them back to school? Are they going to be behind? Are they going to be further behind than their peers that are going to go back into the school environment? And like Mark said, there's very little time left of the school system. Everybody has been out of school, so it's not something that's specific to your child, and that everyone is going to be playing catch up when it comes to September again. And so recognizing that there will be times of uncertainty, there will be a period of time where it is not going to be like grade 3 as usual when you start your kid back in school. They have to do a lot of repeating, but your child won't be the only one doing that. So again, looking at the risk to figure out right now, I think you made a really great comment, Mark, around you've done such a great job over the last 2 months being smart and safe. Don't put yourself at risk now just to get your kids back to school because of these fears and worries, unless it's absolutely necessary.
Great point. And obviously we'll all be watching keenly as things unfold over the summer and looking towards the fall.
And that's a really good point, Jeff, because I think this is a changing field. What we're doing now for schooling is probably going to be different to how September is going to start. And I think we're going to be approaching this with a new normal. Things will never be how they were in January and February. There's going to be a difference, and it's going to affect every aspect of our lives in terms of work, school, and health.
Thank you. So for those who have joined us since we kicked off the session at noon, just a reminder that this is the Ask the Expert session, the latest in a series on COVID-19 and CF. And our concerns primarily today that we're addressing are around reintegration, returning to school, returning to work, those types of questions and concerns from the community. We're pleased to be joined today by 2 experts from our CF clinical community, Dr. Mark Chilvers and clinical social worker Annie Thomas-Diceman. So we had a few questions as well, and I think we'll start direct this initially to you, Annie, is around government assistance. And whether you have any information or insights on how long you think these programs might be active and what options people might want to look at proactively, knowing that these resources ultimately are not infinite. And so what would be your advice for people who have been availing themselves of government assistance and are looking towards the not too distant future in terms of what those options might look like?
So ultimately right now, what we have access to is that CERB program, which is that Canadian Emergency Response Fund. And that's available till October the 3rd, and it can be paid out until December, but you can only, the application is up until that point. And it's set up in these four week terms, and you get paid out for that period of time. So the whole period of time is a 6-month period, but you can only ask for it for 4 months. So the question is, have you applied? Are you eligible? And I actually was looking at the CF website, CF Canada website, and there's a great resource there just trying to outline what you would be eligible for. So going through that plan, I think it's called it's a Find Financial Help During COVID-19, and it's a benefit finder on the Canadian Government of Canada website, but you can find it through a CF Canada. And so that's a really great place to start. It helps to fine tune what you would be eligible for. There may be things that students can apply for and forgiveness for loans that they've received, deferrals on mortgages. Again, these kind of things will impact on your financial situation. Now, when we talk about longer term, about income coming in, this will be interesting to see what the government ends up doing over the next few months, because there may be still changes yet to come. Because if we look at October 3rd and there is no further income coming in and people are still being asked to self-isolate because our numbers are going up, well, my feeling is that the government will do something different, but we don't know because there's so much that's changing every day. Now, that being said, you may need to start looking at any kind of resources you have access to, resources to any kind of funds that maybe you've been saving into that you may potentially need to tap into. The question is, how do you get access to them? Are there penalties to getting access to these funds? The reason why I'm saying that is because I'm thinking about if you needed to look at a social assistance plan in order for a temporary measure, there may be criteria and eligibility criteria that you need to meet in order to get there. So it's just, again, I think the biggest message here is I don't know exactly what it will look like, but maybe working with your team, working with your social worker, your medical team, trying to get an understanding of what to expect with your health and expect with your financial situation. We can help to navigate that and then point you in the right way for those resources. And that resource that you talked about, that information and referral service, Jeff, I think that's a great avenue for patients to look at, just to ensure that you're not missing anything.
Exactly. Thank you.
Yeah, and that's a great point, Annie. And I think that's the thing, we don't know what the fall is going to look like. We don't know, will there be a second wave? And these are all the unknowns, and it's dealing with that uncertainty, and that can be very stressful for families and for patients.
Okay, thank you. One of the questions that's come in has been around the availability of counseling services, and in some cases, people are reporting that clinics are saturated with requests for counseling, and there might be a bit of a wait in that respect. Do you have any recommendations for people who are trying to find alternative counseling resources that could be accessed online, or if there are any other potential avenues that people could explore, whether that's someone who's living with CF themselves or a spouse, a family member, a parent of a child with CF, whatever the case may be?
So off the top of my head, especially in Ontario, there's the Centre for Mental Health and Addictions. There is CMHA. But again, pointing you right back into the CF Canada website, there's a lot of excellent mental health resources and connections there that you can start with. There are plenty of options when it comes to virtual counseling services. Right now, I think almost every person I've referred to that may or may not have had access to a virtual option now has a virtual option through the same clinic that never offered it before. So I feel that a lot of the places now have switched. They're now offering something that they they couldn't do before. They didn't know enough of before. But I think the reality is that people are trying. People are trying to meet clients because they recognize that this is hard for people and that this is overwhelming and that this is definitely stirring up a lot of mental health issues that may or may not have been prevalent prior to this epidemic.
Yeah, and exactly. And I think that people are opening those up. But I think the other thing as well is if you're finding your local clinic is overwhelmed with the requests, thinking about going to your family physician and your primary care physician as well as another avenue to access these things as well.
Great, thank you. And again, as Annie alluded to, we'll put in a little plug for our information and referral services that are available anytime for anyone who is affected by cystic fibrosis, whether that be as someone living with the disease themselves or a patient's support network, family member, etc. We are here to help. And as I said earlier, we will either provide information and resources or we'll find a way to get that to you if we don't have it readily available. Just before we close off, we're about 5 minutes before the top of the hour. Ian, I'll ask if there were any other questions that have come in that we may have missed.
No, I think we're good. Thank you. There continue to be some questions about social distancing with family and so on, but I think people can see those or can hear those responses in the recording afterward. Other than that, I think we've gotten some really good questions. Thank you.
Thanks, Ian. And I'll also remind everyone, and specifically those who might have joined a bit later, if you're not aware of the fact that this is now the fourth session that we've held on COVID-19 and CF in English, and there are 2 French language Q&A sessions similar to this as well that are all available. This one is being recorded and will be available on our website as well for you to use. And we have seen quite a few views after the fact. So if there are questions around some of these topics, chances are you will see something in this or an earlier session that may help to address the questions that you might have. Ian just sent me a text about masks. Masks, there were some, thinking back to the earlier, it might have been the first or second session that we hosted in early April, lots of questions about masks. And they seem to be more readily available now. You seem to be seeing them for sale in different stores. I know I have just in the last couple of weeks. But do you have any thoughts on the use of masks and whether that's anything in any particular type of mask or situations where masks are particularly helpful?
That's a great question. And I think that's one of the things which highlights how views and evidence has changed over the last 2 to 3 months. Before, masks were not mandated, and now coming from Theresa Tam saying that, yeah, masks would be appropriate in situations where social distancing can be a challenge. And yes, it's amazing what sort of masks you can buy. It's like Gap's doing it. It's becoming a fashion accessory. There's a big market for them. And I think there's 2 points. The mask is, I like the idea of a mask in terms of when you go into the supermarket, putting on a cloth mask. It can protect against droplet spread, but it won't protect against COVID on there. So if somebody's in the supermarket who's got COVID, it may not protect you from that. But it's also going to, if you're sick, it's also going to protect you from coughing droplets into that area. So there's a 2-way thing with that mask. I think the important thing is to make sure that you hand sanitize, because the natural thing, you're adjusting your mask and things like that. And then you could also transmit things if you've been touching a high touch area. So I think it's a sensible precaution to take. I think I do it when you're in situations which you can't social distance effectively. And the example I gave earlier was on transit, for example, would be a place where I would do that. Please wear it properly. I'm actually I've got pictures of how people have worn their masks. I've seen them over their head, under their chin, hanging off their ear. And the best one was from a Starbucks barista who had it over his nose, but his mouth was clear so he could drink his coffee. So it's important, if you're going to wear it, hand sanitize and wear it properly with that. But I think it's a reasonable thing, but it's not a protection against COVID-19. That's social distancing, and it's also the hand sanitizing.
Great, thank you.
And we've taken the same message at our program, and we put a blip up on our website, including a couple of videos with how to wear a mask, and the recommendation that people are they're not using surgical masks or N95, that you're using a cloth mask. But again, really talking about the risk is not gone, but it does contain, like Marcus mentioned.
Well, thank you both. This brings us to the end of our time together. The hour's gone by quite quickly. I want to take this opportunity, of course, to thank both of our experts from the clinical community, Dr. Chilvers and Annie Thomas-Diceman. It's been wonderful hosting both of you again, and I know I speak from everyone at Cystic Fibrosis Canada and on behalf of everyone in the CF community and how much we appreciate this, you giving your time and expertise, and also, of course, the work that you do day in and day out to support people living with CF and their families. So thank you both. And thanks to all who joined us today. Thank you, of course, especially to those who sent in questions. And please, I would encourage you to continue to submit questions through our information and referral service. You can contact any of us or email to that service directly, advocacy@cysticfibrosis.ca. And we will continue to monitor the situation and offer future sessions as things unfold. So again, thank you to our experts, and thanks to my colleagues and for everyone participating today, and most of all to all of you joining us for this session. Thank you. Enjoy the rest of your day.
Thank you very much. Bye.